I read this book. Why? I'm afraid to tell you who I am, because that is all what I have. Not to convince or to convert you, but in the next couple of minutes, I would be sharing some of my experiences of interaction, communication, connecting with some of the incredible, terrific women I had met and interacted. I was born in a small town in India. My father used to work in the public sector, dad, Baba, as I used to call him in my native language. Mom, a docile, semi literate homemaker. I'm the single child, as you see the picture. Kind of an ideal small family. Ideal, slightly differently ideal. Around the time I was born, Baba was diagnosed being diabetic, which affected his eyes. Cataract, glaucoma, and finally he became blind in a span of around 10 years when I was in grade 5. Did that made me very sad, agonized? The heart was broken, but the pieces were few because I was born in that situation. I saw the prognosis happen. I saw how his eyes bled every day. I saw how every family level income savings was used more for his care and treatment rather than anything else. And two, because I was growing up more as a caregiver. So my role was more to learn how to walk him, how to clean his toilet, how to give him the shots of insulin, and how to shave him. Until one day, the story was slightly different. Suddenly asked me, can you define the color green to me? And I was like, yeah, they are the trees, the grass. I was like, no, those are just examples. I'm not able to recollect the color. Can you help me? Can you describe the color green to me? I again tried, again gave a whole bunch of examples. And I know that I didn't have the answer that day. I didn't have the answer. I don't even have the answer yet today. But what I realized was, if you can't communicate, if you can't converse in the language of the other person, unfortunately, doesn't make any sense. Moving on. Around 3 years later, by the time I was 13, huge problems started happening between my father and his employing organization around his employability. So implications, multifold and much, much deeper. So being in a patriarchal society as I was, a male member is supposed to earn and run the family. By then, he had already lost his eyesight. Paradoxically, he was forced to take a voluntary retirement, so which means he lost his job, so no income, no savings, which we had. We had to leave this apartment which we were staying, which belonged to the organization, so which means homelessness. Mom, semi-literate. Neither she had the ability, and belonging to a very patriarchal family, she was not even allowed to step out, forget allowed to work outside. So which means a whole bundle of deficit, nothingness, which was there on the family. How did it impact? Penury, almost at the verge of begging, a huge discord which started between my parents, the ugliest form of domestic violence, because each of us were trying to cope up with the crisis we were in. Within me, I think just the survival goal. As if tomorrow is there, then how do I survive through? Like one day when they were fighting very hard, I didn't even want to break the fight. Rather, I just grabbed my dinner and ran out of the house. In India, you have these trash bins, open trash bins on the streets. I went to one of those trash bins. It was cold that night. It was dark. It was scary. Street dogs were playing. I somehow gobbled my food. And then, in the whole fear, I just wanted to throw up. But then, I didn't. I didn't throw up because I thought that if I threw up now, my belly would be empty. And if I didn't get any food the next day, then what? That was the level of poverty, of deprivation, which was happening then. Maybe numbers make things sound a bit more cathartic. Around 40 days of homelessness, that point in time when we were turned out of this house. We didn't have any belongings, just some of our clothes and some of my books, maybe a bare hope that I would be completing my high school. When finally mom found out a very small apartment at an affordable rates where we shifted. For the first time, I think I felt that I could focus, I could study, and maybe complete my high school. We were just trying to adjust to that new space, new situation. 2 years, 3 years down the line, when I was around 16, one Sunday, mom and I woke up to realize that my father has died to suicide. Till date, here now, after so many years, I think I don't have enough of semantics or appropriate sentiments to really describe what it feels when your father hangs from the ceiling fan and your mom lies unconscious on your shoulders. Trust me, we were again turned out of this apartment because the father had died to suicide in this house. Life, that time, if I describe, was just a bunch of punctuations. The institutions I was dealing with, postmortem, bank, hospital, police, a whole lot of just humiliating questions, interrogations, answers, most of them I didn't have. I used to be just teary and stand there. People around me, friends, relatives, neighbors, peers, whole lot of exclamation marks. What happened? How did it happen? How could a blind man do such a thing? Did you never get a hint? Didn't have any answers either. Within me, I think a huge question mark because none of the definitions matched anymore. Home was no more a place of abode, of safety, of togetherness. Peers didn't have any. Relatives were not people with whom I related with anymore. A complete social outlier. I literally didn't have any reasons to live any further, nor did I have any energy to die. I think I stopped there. But at times, the road in itself takes you to the destination. It was at that point in time that somebody introduced me to this discipline called social work. I got through in an university, which was a public university, and because the tuition was so minimal, I could get an admission there and even think of starting studying once again. Integral to social work is field work. And field work means you go to the communities, vulnerable communities, so-called stigmatized communities, and do some community development, community engagement work with them. That was my first realization of first trying to build a connect or understanding that there's some resonance which I could feel between my stories and stories of the vulnerable populations, the rural populations, the indigenous populations. And that's how I chose for my higher education, humanities, social work, population studies. And now I'm doing my PhD in public health with a concentration in community engagement and health policy. It also gave me the opportunity to work with various nonprofits in India and in Africa. And the people I interacted with, so-called labeled stigmatized, vulnerable, polluted populations, sex workers, trafficked women, children who were abused, sexually abused by maybe their fathers and have now contracted HIV, drug-using young adults, prisoners, name them, transgenders. But how did it help me? At an agency level, tremendously, because for the first time, I understood that connect once again, which I felt when I was studying social work. Their stories matched so much with mine. The resonance was so much that rapport building became very spontaneous. Sitting with a group of sex workers became so easy, and talking with them, understanding their stories, learning from them. Two, I guess, also helped me relieve myself. That my father did not commit suicide. Rather, he died of suicide, because suicide is no crime. You don't commit it. You die of it, like you die of any other public health issue. And at the individual, societal, family, organizational level, we have to act towards it so that no person takes such a step as my father did. Third, I guess, the whole spectrum of understanding that this is normal vis-a-vis that is not so normal, mainstream vis-a-vis not so mainstream. I think that understanding, that acceptance, that acknowledgement came within me, and also that appreciation that there is no one normal. Every story, every person, every iteration is real. And not just real, these are people who have dealt with, lived with, smiled, cried, stumbled, fallen, risen up, not just with the lack of resources, not just with the adversities, but with some basics, without some of the basics called love, care, and attention. Unfortunately, much of us do not even get it, these basic things, and we don't even realize. Third, I guess, it was the whole understanding that looking at a person-centric approach is not just enough. One needs to look at that person from a holistic perspective, link that person in the macro situation of how policies are there, how other things are there, and because health and health behavior and human behavior or interaction is more of an interplay between the self and the systems. It's not one person standing alone. Programmatically, it was a huge learning, reaching out to hidden populations. For example, the cannibals in Africa. Now, cannibalism in this region of Africa I'm talking about is illegal. So no data set, no report, no document really highlights that cannibals are there. How did we discover? Dead bodies were vanishing from the graves overnight. And then we understood that the cannibals are there. Now, who would reach out to them? How would programs or a person actually reach out to such kind of people? Only when you build a connect, because so-called these are risky populations. But risk, resilience, and relative deprivation has to be seen in that whole trajectory. Second, made me also very sensitive to very simple things. Like when I was working with a sex workers group in India, a very simple question. And I asked, where do you live? And this lady just flared up. She said, I don't have any address. I don't have any roots. Write whatever you want to. Realized that something which might seem very normal, very natural to many of us could have a very different social construction, very different story, very different sensitivity for another person. And that's how maybe the gathering of evidence of hidden populations, stigmatized populations happened. As that gathering of evidence, subpopulation-based evidence happened, policymakers, program heads got interested, got excited, because then they understood that policies and programs need to be in the language of the people, considering the socio-cultural sensitivities of people, and then only they work. And that's how maybe some of the programs, like the Rural Research Center in India, came up, and this was a rural research center on HIV and AIDS, because HIV and AIDS otherwise is predominantly seen as an urban issue, without realizing that the rural dynamics are very different. Migration patterns are different, living style is different, traditions are different. And that is how, as this Rural Research Center was built up, there was also an understanding, HIV among married women, because you more or less think or presume that it's married women are safe because they are presumed to be monogamous. Men are also presumed to be monogamous who are in the institution of marriage. So I guess, summing up, a couple of things. One needs to learn to play with one's truths, not just embrace them, but play with them, stumble with them, juggle with them. Because unless you're playing with your own truths, the shaky truths, the shady truths, the stigmatizing truths, you are stigmatizing yourself. And once you learn how to play with your own truths, then comes the ability to link yourself, connect yourself to the populations, to the people who are so-called stigmatized, and then becomes a more of an evidence building, more of a respectful connection, and more of building that political will, that connecting with communities, community engagement is not just a bunch of interventions. Rather, it has to be a strong policy imperative. And policy imperative doesn't begin or end in a policy document or in the helm of a policy-making institution. Rather, it begins in the intent, in the sentiment, in the passion and commitment of each one of us and all of us. Thank you so much.